We'll look at how reporters overcome pressure and fear to bring pandemic news to the public. In Nepal, Tzu Chi distributes supplies to families and provide medical supplies to hospitals. Welcome to DaAi Headlines. I'm Siri Su. Thank you for joining us. In Taiwan, after the government implemented Level 3 alert, many citizens stay at home in order to follow COVID prevention orders. However, news reporters must go straight into COVID hotspots to do interviews. For the past few days, DaAi TV reporters prepare ethanol, protective clothing, and goggles in order to reduce the risk of infection. These reporters must overcome pressure and fear as they have to bring news to the public. Let's take a look.
从台北北农到华南市场所衍生的相关情境案，到目前也都还没落幕。
幼儿园及科教中心老师开放施打疫苗，预定在开学前接种完2剂，增加保护力。
After the COVID hotspot outburst at the end of May, news reporters are fully geared up to do interviews at hospitals and rapid screening stations.
If we go back to earlier times from the cluster infections in hospitals, we have to wear full protective clothing, and the same goes for rapid screening stations after the infections at Wanhua district. These areas will provide risks.
We wear protective clothing, and after taking it off, there will be problems, like the clothing sticking to our skin. So I thought, will there be any risks of infection when I take off my protective clothing?
News reporters must keep a proper distance with interviewees during their interaction.
Suddenly, when many people stand over there at a distance and think it's hot, we cannot hear what they are talking about. Sometimes when we are in a rush, we must listen to the footage again. It's a rush since we have less time to work.
After reporters wear masks and protective goggles, the steam coming from breaths will normally cause fogs at the camera lens, disturbing the footage capturing process. There might be a lot of movement, and when we stop, fogs rise like me talking right now. There will be situations that cause us troubles. Though news reporters aren't at the front line, the government enforced strict policies. At the CECC press conference every day at 2 p.m., proper measures are taken under the collaboration of people within the same industry.
For example, our workers decrease, and with the remaining people, we have to split them into A and B groups, working at a 3-day shift per group. So you have to do something that's not your shift. You must ask your colleagues to do your task, but your colleagues might be so busy too, so they cannot guarantee an answer. So you must adapt and change your news direction.
Some reporters are also news anchors, as the pandemic created different shifts, forcing some news anchors off their previous roles.
The pandemic came rushing into Taiwan, so actually I never thought that much about it, on what I should be doing. I just went directly to places, and I felt that the most important mission is to bring proper live footage and reports to the audience.
After returning to the office, microphones and cameras must be disinfected thoroughly. At work, a reporter, and after work, a normal person. These reporters with family members do not wish to bring risk back home.
My family will call me every day and ask me if I've protected myself properly. They also ask me if I disinfected properly. I felt scared, but also felt a sense of responsibility. Because of this, I'm afraid of going home. My parents live in Taichung, and I haven't been back home since Mother's Day.
I think like during this time, I learned how to properly disinfect. Before, when I went back home, I felt tired and refused to go straight to the shower. Now, after following proper COVID prevention measures, I will disinfect the floors after working upon it at home.
As medical workers strive to lessen the casualties of the pandemic, news reporters take on the responsibility to bring proper COVID-related news to the public, alerting the public with a good intention.
Taiwan's medical workers are at the front line fighting the pandemic. A number of doctors at Taichung Tzu Chi Hospital have switched from their respective departments, treating those with chronic diseases to frontline support services, including rapid screening. They're doing their best to fight the pandemic.
There is a smile in the eyes and warmth in the smile. These doctors supported the rapid screening station of Taiwan Elementary School. When they took off the protective equipment, the face was full of marks and the body was soaked with sweat.
Because of the hot weather plus the long working hours, all of our staff are actually sweating a lot.
No matter how much fatigue and suffering, they're supported by willpower. Going back to the dedicated COVID ward and taking care of confirmed patients through video at any time. Song Yumin, who has 37 years of medical experience, is specialized in endocrine metabolism. This time he stands on the front line to fight COVID.
Everyone has put in a lot of physical and mental effort, but I think these cannot match with the pain that patients have suffered. I think our contribution is still quite worth it.
Facing the raging COVID pandemic, there's no time to slow down. At the emergency screening station, the rehabilitation team is providing full assistance.
To relieve the medical capacity of the frontline emergency unit.
Our rehabilitation department generally deals with chronic disease. For this acute infection disease, frankly speaking, it is actually very strange to us.
Despite the anxiety, they do not hesitate to help, as they want to protect their homeland in Taiwan.
In fact, it's unlikely that you won't have some panic psychologically, but we still have to believe in professionalism.
Resolving anxiety with love and serving in the professional field with heart. These doctors look forward to the day when the pandemic is over.
As the pandemic spreads, medical workers join in due to the high demand for labor. 31-year-old Li Chuijian is an overseas Chinese from Indonesia. He has served at DaAi Tzu Chi Hospital's ICU department for nearly 4 years. He's now part of the dedicated ward team. He said that now is the time for everyone to work together and help patients with professionalism.
Though protective gear has covered half their faces, the familiar voice brought comfort to patients and their family. Li Chuijian is an overseas Chinese from Indonesia, as he gained experience through free clinics in Indonesia. After graduating from TCU School of Medicine, he served at DaAi Tzu Chi Hospital's Department of ICU. During the pandemic, he served at dedicated wards under the encouragement of co-workers.
Protect yourself with care because the danger levels are much higher than what we have right here.
Through a mobile quarantine box, doctors may collect specimens of COVID-confirmed patients. At the scene, Li Chuijian patiently explains the conditions to the patients, comforting these people. It's because this is new to us, and our senior colleagues have less experience in the situation. So facing a new field, we must learn a lot through the process in order to understand and properly battle the virus. As the pandemic brings great pressure to frontline medical workers, our young doctors contributed more in order to safeguard patients' lives.
When Hualien City Medical Center established dedicated wards for COVID patients, Lu Ruzhe was the first nurse to join the team. He said that he also had fears of contracting the virus, and he did not even tell his family that he's taking care of COVID patients. However, as time went on, he has helped a lot of COVID patients fight the disease, and he has won his family's support.
When we first turned on Skype, the family members were crying. Family members would say, "I love you."
The grandpa who suffers from COVID-19 is in critical conditions. As his family cannot be by his side, the nurse has taken a tablet for them to bid farewell.
When the family members saw the patient for the last time, we have removed his tubes and cleaned his body. I was struggling internally, as the family cannot be by his side.
When Hualien City Medical Center established dedicated wards, young Lu Ruzhe decided to join the medical team.
If no one is willing to do the work, in the future, there might not be anyone to take care of COVID patients. When I first started working there, my heart rate was very fast. However, later the situation improved and it overcame my fear.
Concerned about his family, he did not tell them he's taking care of COVID patients. However, his family's reaction surprised him.
It is inevitable for me to worry for him. However, if he is prepared, I think it is all right. I believe he can do a good job as he is very responsible.
With his family support, Liu Jie has more confidence he can shoulder the responsibilities and care for COVID patients. Nepal is the hometown of the Buddha. After the pandemic in April, Tzu Chi Foundation collaborated with local charity groups. They distributed relief supplies to disadvantaged families while providing medical supplies to hospitals. Let's take a look.
Tzu Chi Foundation provided boxes of medical supplies to a dedicated hospital taking in COVID-19 affected patients, hoping to fulfill their demand for medical supplies.
Namaste. I would like to thank you, Tzu Chi Foundation, for providing us different kind of personal protective equipment for the COVID care. I would like to thank again.
Besides the hospital taking in COVID-19 patients, locals at the town also requested help from Tzu Chi as volunteers arrived with supplies. Our town is close to Kathmandu, therefore the risk of COVID infection is high. As of now, there are no organizations that reached out to us. I'm thankful to Tzu Chi since they gave us oxygen generators and other medical supplies based on our needs. Since Nepal is close to India, in April, the entire country goes into lockdown due to the increase of COVID cases, causing many impoverished citizens to go into difficulties. But after the lockdown was uplifted in June, Tzu Chi collaborated with local charity groups to initiate relief distribution. The 10-day distribution starts from June 26 till July 5th, as every household was able to receive rice, flour, beans, cooking oil, salt, sugar, and soap. A total of 3,308 households were benefited.
We came over from different places to Kathmandu, but during the pandemic, there were no job opportunities or food. It's great to receive food now. It's a blessing from the Buddha. Thank you so much.
I'm happy to receive the food supplies. It will allow my family to eat for a month.
After the relief ended on July 5th, Tzu Chi Foundation will continue to plan for the next wave of distribution, hoping to help over 5,000 families in need at the mountainous regions of Kathmandu.
In the Philippines, the Federation of Chinese Chamber of Commerce has donated 500,000 COVID-19 vaccines to the country. The government has asked its City Philippine chapter to establish a large-scale vaccination station to serve the people. Let's join them there.
我们可能会建差不多20个这种帐篷在这边到时候这些打疫苗的人可能在这边等待，空气会比较好。
To prepare for the large-scale vaccination center, Manila Tzu Chi volunteers mobilized. Everyone had been preparing for half a month prior, readying to accept 500,000 vaccinations donated by the Philippines Chinese Chamber of Commerce.
This is peak pandemic time. If we can provide adequate vaccination to everyone right now, then I believe it's good for all our health.
Thanks to the generous donation, the government and private organizations can come together to serve the people. At the Tzu Chi grounds, vaccinations started on July 5th and will be open for 12 days.
This is something to protect the health of the people in the Philippines. It's something we must support fully. It's a rare opportunity to have this set up at the Tzu Chi grounds. It really is.
During the first 2 days of the vaccination, there weren't as many reservations as anticipated, but the volunteers and medical staff continue to uphold their standards of friendliness and passion. Christine Gonzalez lived in Leyte in the past and had received Tzu Chi's signature love and care during Typhoon Haiyan. Thanks to the affinity after her vaccination at the Tzu Chi grounds, she was eager to adopt a bamboo coin bank.
I know Tzu Chi's funds come from the generosity of others, and even though each donation might not be very much, I know Tzu Chi will be able to do great things with the amount I donate.
Manila volunteers say that the queue for the vaccination center is prepared for about 1,000 people a day. Although the first 2 days there weren't that many, it is hoped that in the next 10 days they can serve more people.
Kongdang village in Jiangsu province was hit hard by a tornado in 2016. The city foundation helped in the construction of Kongdang DaAi village. After that, it promoted a rural revitalization plan. In addition, the medical team of Shanghai Hudong Hospital was also invited to organize regular health checkups for the villagers.
Tzu Chi Foundation maintains close interaction with the villagers in Kongdang DaAi village. For the past 3 years, Shanghai Tzu Chi volunteers and medical team of Hudong Hospital have also continued to organize health checkups.
All the departments of the hospital sent medical personnel over, which is equivalent to a miniature version of the general hospital. It's not an easy task to get everyone here, but I think all of the medical staff are motivated with the heart of joy, just like the Tzu Chi sisters.
Grandma Zhou suffered a limb spine fracture last year, but her children were not around to help her seek medical treatment. On the advice of the orthopedist, Dr. Ma, she went to the country hospital for a minor operation and is feeling much better.
For elderly patients in rural areas like this, in fact, it is still not very convenient for them to see a doctor. So we just do what we can do to help. If we can do some treatment within our ability, it will improve their quality of life.
Because of the large number of patients and the rich experience of doctors in the large hospitals, they can find diseases that are not typically seen. Therefore, many young local doctors came to learn from the experienced doctors this time.
Director Ma sets an example for our younger generation in physical examination. Although it is very basic, there are many doctors who can't do it now. Director Ma is doing the investigation very seriously. It's pretty good, and it's worth learning.
At our local request, our hospital expanded the scope of services and invited experts from our local Banhu Town Hospital and Funing People's Hospital to help our local people together. We hope they can get to know some doctors better when they are sick.
Medical staff and volunteers work together to protect the health of the rural residents, so there is no gap between urban and rural areas.
After July, the weather is hot, but a group of volunteers from North China was half a year early to conduct home visitations. They're preparing to send winter supplies in the winter. In Yi County, Hebei Province, volunteers from 6 places gathered together. They went to 12 villages to visit families in need and send care. Let's join them there.
It's just the summer, but Tzu Chi volunteers in North China have started conducting home visitations to prepare for sending winter supplies. A sanitarian grandma Zhao lives alone. Her youthful face surprised the volunteers. Everyone sang the blessing song and asked her for the secret of longevity.
奶奶，你有福气呀，真是。你100岁了，你说哪像100岁的人啊？不像呢，一点都不像，把我们吓着了。
Zhao Wenyuan, who once served as a village staff in Sanpu village, has mobility issues due to the illness, and his depressed mood also affects his wife. The volunteers also gave his wife encouragement.
谁都会吃误啊，哪有不得病的呀？有点病很正常，没事的，一定会好的，一切都会好的，一切都会好的啊！这么多房子啊！
Zhao Zhonghua, a thin girl, looks even smaller than her actual age because she often gets sick and repeats grades. The volunteers feel sorry for her.
Look, you didn't eat much. You're too skinny. When there is sun, go out to bask in sun, and then eat more fruits and vegetables.
Volunteers from 6 places gather in Yi County, Hebei, and visit 12 villages in 2 days. With a total of more than 150 families, the ones who rewarded the most were local volunteers.
When I walked into the home of every villager, everyone was very enthusiastic towards us. They shook hands with us and shared with us the things in their lives. The 2-day visit has been very rewarding for me.
With the help of the senior volunteers, more people are encouraged to join in the ranks of doing good, so that the rural areas in need can be filled with love.
After being exposed to delicious vegetarian food at the TIMA convention in Taiwan in 2012, city volunteer Liang Ming returned to Singapore and started to eat more vegetarian food. After experiencing the health benefits of a vegetarian diet, she finally decided to become a vegetarian and share this message with everyone.
Every day before dawn, the kitchen is busy.
I will try to match 5 kinds of fruits and vegetables and pay attention to protein intake because it's part of adequate nutrition. Everyone is willing to continue to be vegetarian if they eat healthy food.
For more than a year, Liang Ming, who is a nurse, brought vegetarian lunches for 2 colleagues every day. In 2012, she was exposed to delicious vegetarian food at the annual TIMA conference in Taiwan, which made her start going vegetarian.
Because of health problems, I made a vow to go vegetarian. Being a vegetarian has benefits for my health. I also hope that everyone can eat it. Vegetarian food is simple, delicious, and easy to make.
However, Liang Ming encountered a lot of obstacles in the process of pushing such a diet.
They will say, you should just eat what you like and don't come and ask me to be a vegetarian like you.
In 2020, Tzu Chi volunteers launched a 10-week campaign to deliver vegetarian meals to medical staff. This also unexpectedly opened up Liang Ming's opportunity to persuade hospital staff to go vegetarian.
They said that vegetarian food can also be delicious. I am so grateful for Tzu's brother who made me dare to recommend veggie food to my medical colleagues.
Liang Ming, I'm here.
Li Puixi is Liang Ming's colleague. Since eating Liang Ming's lunchbox more than a year ago, vegetarianism has become a daily routine at her table. She also invites friends to eat vegetarian food from time to time.
After eating vegetarian food, I feel healthier. My stomach and intestines are also better. Next, I want to change from my current 1 meal a day, slowly increasing the number of the vegetarian meals.
Slowly, meat eaters are turning into vegetarians as many hope more people will choose vegetarian food for the benefit of their health.
At Taipei Tzu Chi Hospital, there's a dialysis patient who has been diagnosed with COVID-19. A nurse has been treating him like her own child. She even helped shower him during her off-work hours. We'll leave you with these images. Thank you for joining us. Goodbye.